I don't understand this one, and I'm going to tell you why I don't understand this one. Because so far, I believe our government has been very cooperative with the United States. I mean, even the matter of the deportees, people are saying them you shouldn't allow them to come. I mean, next Tuesday, 60 of them are coming. So I don't understand why the U.S. would block Jamaican test kits.
Yeah, but it's not just Jamaican test kits, though.
Yeah.
From what I've read, it's a lot of other countries who they're blocking kits going to the countries. They're blocking ventilators. There's a lot of things happening coming out of the USA.
Why would you do that? Why would you not want other countries to be able to respond effectively? Well, this says the government says it will not be using the Cuban antiviral drug interferon alpha 2B to treat persons battling COVID-19. This development comes in as Washington blocked a supply of test kits destined for Jamaica. Jamaican authorities had said they would have discussions with their Cuban counterparts to get more details about the antiviral drug, which is one of several being used by the Chinese to fight the new coronavirus. The drug is said to have proven effective for viruses with characteristics similar to those of COVID-19.
Yeah, but Tufton had said an assessment was done, and given that the drug was not approved globally, Jamaica would not use interferon alpha 2B at this time. Tufton told parliamentarian colleagues that advice came from the Chief Medical Officer, Dr. Jacqueline Bisseur McKenzie. And Tufton went on to say, and I quote, "I can only go by the advice given to me," adding, "It is not that we have not looked at it. As you know, we've been collaborating with the Cuban government in several ways, and we are very appreciative in terms of the clinical capacity that has been added to our front line against COVID," end quote.
Yeah, he was also commenting on our capacity to test. He says the country had enough supplies at this time, noting that the equivalent of 20,000 test kits would be arriving in the island by this weekend. However, he divulged that the Trump administration had blocked test kits that were destined for Jamaica from that country. They have acted in their interest, we have to act in ours, he said. But I don't understand why blocking test kits would be to the interest of the United States.
Yeah, because they probably think that they have more people to test than we do.
So why would not just make more test kits? The U.S. have the capacity. I'm asking you a rhetorical question because I know you can't answer. It just don't. On the heels of what has happened with the U.S. and the World Health Organization, I think it's a global pandemic.
A lot of things aren't sitting well with the globe. Everyone across the world, with how certain countries are handling this pandemic, because they feel as if they're being slighted because a first world country is stepping in and taking away things that they would need. Third world countries, second world countries that they would need to test.
We can't do that. We can't be. Well, I'm sure it applies to countries as it applies to individuals. Mm-hmm. When you have the capacity and God has blessed you, you need to help others because you never know. Let me tell you something, COVID-19, not just picking on small nations, everybody is feeling this. So if this pandemic don't teach us anything about helping and being your brother's keeper, helping your brother, then I don't know what will.
You know what, I was reading something recently and it said, in the times of crisis, the strong will need to help those who can't help themselves.
In times of crisis, people also show you who they are.
Of course.
But so to me, the U.S. is a friend of Jamaica. So I don't get it. I'm hoping that by tomorrow, there is a change.
Or later today.
There's a change.
Yeah.
Well, a plane coming next week, Tuesday, with 60 odd deportees. So if them could have please put the test kits in the bottom of the aircraft, I would be most appreciative. But we need to test.
Yeah.
So I don't know. So we'll see.
All right. The second thing, Sutherland closes South Camp Road call center amid possible COVID case. So Sutherland said its South Camp Road facility will remain closed until further advised. And in the meantime, it will do deep cleaning and fumigation of the entire site. Mm-hmm. So Sutherland Global has temporarily closed the South Camp Road office because, COVID-19, corona scare, we've seen what has happened in the past 2-3 days with the BPOs and COVID-19 and the spread of COVID-19. And in an email to staff members, Sutherland's country head for Jamaica, Doug Allman, said the employee has been tested by health officials and results are expected in 48 to 72 hours. However, he said, out of caution, Sutherland Global has decided to close the facility effective 8 p.m. Wednesday, April 15. He said, too, that the Sutherland employee was listed as a close contact of a worker at the ILO call center in Portmore, St. Catherine, who was tested positive for the virus. Aye.
Yeah.
Boy.
Yeah.
So yesterday and the day before, a total of 52 cases in 2 days.
One time.
Crazy. That's crazy.
And, you know, I had this conversation with someone and I said, in times like these, I understand a business's right to operate in a particular way, but at a global level, the International Labour Organization, the ILO, has issued COVID-19 guidelines. And it has said these are the rights of the employees during COVID-19, and as the employer, you are expected to do certain things. So, which is why yesterday I was having a debate with someone that yes, the Ministry of Health is the overarching person, but the Ministry of Labor, because ILO don't deal with health, Ministry of Labor needed to, and still needs to, if they have not done so, they might have, say to groups like the BPOs, these are the things you must do or you can't operate.
Yeah.
Plain and simple.
And that's true.
Because you can't be saying to the general public, you have to be 3 to 6 feet, and then you're working right beside somebody right here. You can't say certain sanitization things have to happen basic, and it not happening there. You must wear masks, it not happening there. In an organization that hire close to 800 people.
Because one BPO is 700 people working there.
Costa Rica, so, 787 people. Yeah. That's bigger. That's a community. And if you go to some communities in Jamaica, that's a whole community.
So when you talk about community and now the community spread, it doesn't necessarily mean where you live in. Community spread can be where you work. So this is where we're seeing the community spread, the next phase of the virus spreading. So it's people just have to be mindful.
Shut down a whole parish.
Shut down, it's because it started at Bull Bay. Bull Bay got shut down, now St. Catherine, and people are fearful that it's going to continue to happen.
But Bull Bay is a community.
It is a community, yeah.
St. Catherine is a whole...
But St. Catherine is almost like a community.
It's a massive parish.
Yeah.
You know what I mean?
And that was evidence from when the announcement was made and people trying to leave St. Catherine, Portmore especially. So it's serious, and if we want to help each other, we have to stay home. So, I mean,
I'm reading this about Sutherland, but and I'm not picking on BPOs. Listen, we weren't picking on markets either, but every market did have to close down and wash out and sanitize and have different operating hours and so on, because we understood that the way the market is set up, it can be tricky. So the BPOs have to understand that the way you're set up, there is a problem. And we're talking about Sutherland in Kingston. We're talking about Alarica and Portmore. I don't want to start calling names, but there are other BPOs in Portmore. There are BPOs in Mandeville. Whole heap of BPO there, Montego Bay. So who take up the phone since Wednesday and call the BPO people and say, if me come there, and me see people less than 3 feet, we have to go lock the BPO.
Yeah. I'd like to see what the other BPOs have done, though. That's what I'd like to see.
Them better do something. This is serious. All right, and yesterday I was reading that our media colleagues from another station were saying that Alarica had closed their call centers in Guatemala and the Dominican Republic. Yeah. But our one did still open.
Yeah, I think it was early March. March, and we had a few cases.
Come Jamaica, I'm going to take this serious.
So I thought that was a global decision by Alarica. So we'll find out more about that.
All right.
Yeah. This one kind of touched me because I think about all the families around the world. I think about people who have families everywhere, and just imagine you being stuck somewhere, not able to come home to your family. I was watching All Angles last night, and a young lady who's, I think it's Barbados or Bahamas, she's stuck there, can't come home, her kids are here, and it's It almost brought tears to my eyes because I think about my own mom who is away and other family members who I have in different places and they can't come home. You know, I can't see them. I mean, we talk over the phone, but their physical presence, they're not there. So this story, Prime Minister Holness, the government working very quickly to put a protocol in place to help the 43 heartbroken Jamaican ship workers who were denied landing when they docked south of Port Royal in Kingston 2 weeks ago. Holness addressed the issue on Wednesday as the opposition raised questions in a late-night session of the House of Representatives. Prime Minister Holness said, and I quote, "We have heard their cries, we have heard their complaints," end quote. According to the Prime Minister, it was unfortunate that the Marbella Discovery 2 left Jamaican waters on the afternoon of April 3rd before the requisite process could have been completed to facilitate the landing of the ship workers.
Yeah, it is unfortunate. But he's saying he's heard their cries. So this... I hope this is not another St. Catherine situation, and I'm going to explain what I mean. So the response to shut down the parish was fine. The implementation needed fixing.
Yeah, there are questions about
needed fixing. If we hear the cries of the 43, there are over 900 Jamaican workers on ships around the world. So we have to go hear the cry of the 900. We can't decide, so we're going to take some and leave some. Now, if you're going to open to letting 900 people, I'm not arguing that we shouldn't. I'm just saying, don't make the 900 reach here, and then when them reach here, people say, what we should have did.
900 get
check
here.
them when they come off of it, and we should have did, and we should have did. Maybe it's happening, but I'm not getting the feeling that it's happening, that we are in a disaster risk mitigation and response situation. You have to come up with scenarios and ways to solve the scenarios. Yeah, so you're going to shut down St. Catherine. This might be the scenario. People are going to want to leave. So this is what we should do. We're bringing home 900 people.
Yeah, and I think about that, and it's almost like the New York flights that came in.
Right.
The thousands of people who came in on a New York flight. Almost 4,000 plus Jamaicans who came in via aircraft. You know, it's almost a similar situation. How do you treat with it? Because now you mentioned 900 workers on ships around the world. How will these ships get here? What's the decision that the ship captains will take? Because, you know, the ships aren't owned by Jamaica, they're owned by different countries. What are the decisions that will be taken? So,
but when them reach here, that's what me want to know. It's like the deportees that are returning home.
Precisely.
Guatemala says 75% of the people being deported have come home positive with COVID-19.
And there was a report that the US said that they won't send back patients who test positive for COVID-19. So I don't know.
We test them before they go on the plane, when they come on the plane. So me just want to know, when they come,
we still have to do our tests.
where do they go?